What happens if you miss a dose of TB medication? Have you ever wondered what could happen if you miss a dose of tuberculosis medication? Tuberculosis treatment is crucial and involves taking multiple antibiotics consistently over several months. Missing a dose can lead to some serious consequences. First, skipping a dose can reduce the effectiveness of the treatment. When you miss a dose, the level of antibiotics in your body drops. This lower concentration may not be enough to kill the Mycobacterium tuberculosis bacteria. As a result, the bacteria can survive and multiply, which can prolong the infection and delay your recovery. Another significant risk is the development of drug-resistant tuberculosis strains. When the bacteria are exposed to lower levels of medication, they can mutate. This mutation can make them resistant to one or more of the drugs used in treatment. Drug-resistant tuberculosis is much harder to treat. It often requires longer and more complex therapy, and the outcomes can be worse. Additionally, missing doses increases the risk of relapse and transmission. Inconsistent treatment can mean that tuberculosis is not fully eradicated. This can lead to a relapse of the disease. Moreover, if you are not fully treated, you may remain as infectious for a longer time, which increases the risk of spreading tuberculosis to others. Missing doses can also impact the duration of your treatment. Healthcare providers may need to extend your treatment or adjust your medication regimen to ensure the infection is completely cleared. This could also lead to more frequent monitoring and follow-up visits to assess how well the treatment is working. So, what should you do if you miss a dose? If you realize you missed a dose, take it as soon as you remember, unless it is almost time for your next dose. Never double up on medication without consulting your healthcare provider first. Always inform your healthcare team about any missed doses so they can guide you on the best course of action. Maintaining adherence to tuberculosis medication is vital for successful treatment. Many treatment programs include support measures, such as directly observed therapy, where a healthcare worker supervises your medication intake. This helps ensure that you complete your treatment without missing doses. In summary, missing a dose of tuberculosis medication can compromise treatment effectiveness, increase the risk of drug resistance, and lead to prolonged infectiousness. Consistent adherence to your prescribed regimen and open communication with your healthcare providers are essential for curing tuberculosis and preventing complications.